It's high time Americans be allowed to treat COVID-19 like other illnesses. Hello, I'm Steve Forbes, and this is What's Ahead, where you get the insights you need to better navigate these turbulent times. After 2 years of lockdowns and mandates about masks, vaccines, and physical distancing, Americans are more than ready to resume normal lives. The polls show it overwhelmingly. It's long past time for Washington, and most specifically the President, to declare the pandemic is over and sweeping emergency measures and restrictions are terminated. People are well aware that COVID variants may stay with us, but we've had enough experience and knowledge to respond appropriately on an individual basis. If we get sick, we stay home. If we have serious underlying conditions, we take precautions if there's an outbreak. We're more than ready to live with this virus. Britain, Denmark, Sweden, and other countries are throwing off emergency measures. Unfortunately, certain politicians and public health officials here give the impression they don't want their special arbitrary powers to end. Take masks. Actual experience here and overseas is overwhelming. The kids need not wear masks. In fact, the evidence is clear, particularly for youngsters, that wearing masks does real emotional, social, and educational harm. Yet masks are still being required in all too many schools. In a true dereliction of its mission, the Centers for Disease Control still encourage masking in schools. This is science fiction, not science. People are sick and tired of idiocy, such as certain schools forcing students to eat outside in the cold with masks. Given the modernized air circulation systems in commercial aircraft, requiring masks on board is unnecessary and aggravating. Vaccines are another source of discontent and misinformation. Given the nature of COVID-19, they are not necessary for youngsters and adolescents. In fact, for certain kids, they could do more harm than good. Contrary to impressions given by certain officials, they don't stop the spread of the virus. They don't prevent reinfection and transmission. While they don't always protect you from getting the virus, vaccines clearly lessens its impact on you, saving you from going into an intensive care unit at a hospital or even from dying. The evidence on that is clear, so except for special medical cases, people who don't get the jab only jeopardize themselves. There's no need to force people to vaccinate. Washington and Canada should back off on this. Especially shocking are doctors who refuse to treat unvaccinated patients. Do they also refuse to treat patients who eat too much, or drink too much, or who smoke, or who don't exercise? Then there are lockdowns. A new study from Johns Hopkins eminent economist Steve Hanke and colleagues from Sweden and Denmark examined the results of 24 studies of pandemic lockdowns and found that lockdowns had distressingly little impact on COVID mortality, but inflicted enormous other medical, emotional, educational, economic costs. Washington must immediately remove the COVID cloud by ending restrictions now. I'm Steve Forbes. Thanks for listening. Do send in your comments and suggestions. I look forward to being with you soon again.